Dr. Kourakin, let's talk about children. What does a mom have to do, or what should a mom not do? Something, once she has a child, when should she bring the child to the doctor? Hey, maybe it starts even before the mom has the child, because you talked about how devastating gum disease is. So maybe a mom who's pregnant should very much worry about gum disease. But anyway, tell us all about children. When should they come to a dentist? Why? All those type of things. What should the mom do or not do with her kid?
Well, I agree 100% with you, Helmut, that the mother should come to the office when a child is in utero, because the mother needs to understand that the development of the fetus, that in the fetal form, teeth are already beginning to form, and she needs to make sure that she's going to provide that fetus with all the proper nutrients there, the vitamins that the OBGYN will prescribe to her, that's going to assure that or give the best assurance possible that the child is going to develop as normally as possible. Once the child is born, then it's almost too late for her to come into the office, because they're not going to bring a month-old infant into the office there. So at that intrauterine phase there, we can say to the mother, here's what you should do to an infant there. There's different devices there that they can place on their finger to clean their gums, to start telling them about the teething pain that's going to occur even with the very first tooth and what can be done. And it's interesting because different countries have different philosophies about teething pain and what can be done to help a teething child, even though you won't even be bringing the child into the office. And then let's fast forward to the point where the child is.
Tell us a little bit about what can be done there. Give us a couple of ideas of what can be done here.
Everything from using devices that are cooled in a refrigerator or cooled in a freezer that have abrasive surfaces, to using numbing agents on the gums to allow the gums to be numb, to allow the tooth to break through, to what many people in France do, which is to use a very abrasive device to numb the gums, and using a very abrasive device that actually breaks the gum for the child, and it accelerates the movement of the tooth through the gum and minimizing the time period of the eruption of the tooth. So these are the kind of things that will help the child in their teething pain, making sure that the gums are clean and free of plaque so that the gums are not irritated and further causing the child more distress.
So you're saying that even though no teeth yet, plaque can build up already?
Plaque will build in the mouth everywhere, on gums, on teeth. It's amazing. Tongue rings. Plaque is just pervasive. It will form and stick to anything.
All right, so now the child has teeth. When should the mom bring the child to the dentist, kind of the first time, and what's kind of really the purpose and what's happening there in that visit?
What we like to do is we like to have the mother come in for her own cleaning, and she can bring the child with her, and the child will sit in the corner of the operatory, and the child has their mother as a role model, and the child will see the mother having their own cleaning done, and they see that it's not hurting the mother, the mom's happy, the teeth are feeling good. We'll invite the child come over to look into the mom's mouth there. We'll give them the mirror. We'll play some little games, some dental games with the child there. And then we will switch it around. Then the mom will get out of the chair and we'll say to the child, Johnny, please come up into the chair. The mom will invite him up there, or if the child is a little hesitant, maybe we'll bring the child and seat the child onto the mom's lap, because at this point, the child may only be 2 years old or perhaps 3 years old. Anywhere in that period of time is where we like to start the children there. But we want to start them with a positive experience, just getting the instrument in the mouth, letting them become familiar with myself, letting them become familiar with the hygienist there, a totally positive experience there, so that we get them started with dentistry being the right thing, having the right attitude about dentistry. And then we'll bring them back at another visit there, and then we'll attempt to do the cleaning. Or sometimes, even if the child is a little bit more mature, we'll attempt to polish a few of the teeth there. Just something to kind of break them in and get started with the whole notion of seeing a dentist. Unfortunately, there are times where even a 2-year-old can have a severely decayed tooth. Baby bottle syndrome is a very sad thing that occurs. And unfortunately, sometimes we have to use sedation dentistry to actually take care of children's teeth.
Tell us a little bit about the baby bottle syndromes. We keep hearing about it. In fact, it was just a couple of days ago that I heard something about it on the radio. And, what do you do there, and what is the real problem with it?
Well, the problem with it, unfortunately, is too many parents are too quick to pacify the child with a bottle of either juice or milk, anything but water. And every time we apply that kind of a beverage, that beverage is going to break down into an acid, and that acid is going to attack your child's tooth or teeth. And if left for too long, too extended a period of time, we're going to have a problem with cavities forming throughout the entire mouth. Many times the parent is not even aware because they do not check the child's tooth or teeth. And now suddenly the child is screaming in pain because they have an exposure of the nerve, or the decay has actually eaten through the enamel, through the dentin, and into the nerve chamber. Or suddenly the mother or the father will notice, oh my God, there's this big black hole in the center of my child's tooth. What is that? When they try to rub it off, they see that it's a cavity, and now we have a big problem. So we have to be very careful, and we have to watch and how long we allow a child to keep a bottle in the mouth. Certainly not overnight, and certainly not for any extended periods of time. And certainly, if we can't get a toothbrush into the child, then we need to get a finger cot, a washcloth, a paper towel, anything that we can rub over the child's teeth just to remove that plaque from the surface to prevent cavities.
Well, all right, that makes lots of sense, because after all, here you dentists teaching us to brush our teeth after every meal, so why would you actually go to bed and have a bottle in it and soak your teeth in milk, which is full of sugar and acidity, or apple juice, or whatever it might be. And maybe if it helps the children, because obviously the young generation, it wasn't yet the case in my generation, and maybe just not because of the country I grew up, I really don't know, but we had a soda. I mean, that was an event. And today, water was the thing to do. There was no, apple juice and stuff. Everything was juice and soda. That just didn't happen. So maybe if a kid drinks bottled water at night and stuff like that, as you mentioned, maybe gets used to be a little bit more drinking natural water, and not all those sodas, maybe, which, has all kinds of other effects, never mind rattening the teeth. So, great. Now, tell us a little bit about, why is it so important, and is it actually so important to maintain those baby teeth? Because I remember my father putting a little string around it with something my mom was sewing with, and yeah, we even put it to the door and he made great fun out of it. And I for some, sure. For some reason I never needed braces or so. And anyway, it's a baby tooth. I mean, why worry about it hurts? Well, let's get it out. In a year or two, it comes out anyway. Is there a problem with that? Is there a reason for them to keep them alive and good? Tell us about it. Or not? Is there not? Is it kind of okay to just knock them out premature?
Well, fortunately, nature in its infinite wisdom and beauty had actually created a sequence, a chronologically arranged sequence where the baby teeth need to fall out in a certain pattern, a certain age. And at that point, different teeth come in that will then fall properly into position. If we prematurely lose baby teeth, permanent teeth will come into a spot that perhaps they should not be into, and then that will block the further eruption of other permanent teeth, and we can actually end up with impacted permanent teeth because there's no room left for these other teeth to come into position. So chronologically it's critical.
I see. So basically what you're saying is the baby tooth has a role as channeling the next tooth.
A space maintainer, if you would.
Right. Besides the fact that probably, I don't know about all people and all things, but maybe more and more, children are probably rather self-confident also, so if they have a missing tooth and get nickered or hecked or whatever you call that in school, they probably don't like that either, right? It's probably
absolutely. And more importantly, Helmut, think about this. The older the child, the more mature they are, and the more they're apt to floss and brush. And I would rather see them have an issue with a baby tooth than a permanent tooth, so that they lose their baby teeth prematurely. At an early age, they're going to be expected to maintain permanent teeth for the rest of their life. Well, if I could have an extra year or two of maturity and understanding and tactile sensitivity and motor skills, I would rather have that kind of a condition to maintain our permanent teeth than, as I said, a less mature, a less tactically sensitive younger child.
Makes sense. Well, all right. So basically, keep maintaining your teeth. Let the dentist decide when it should come out forcefully or not, and how it mono, because there's a reason for it. And get the child used to a dentist rather fast, so that hopefully the first visit doesn't have to be with a drill. So it's just a pleasant kind of chair ride, so to say, and counting the teeth and having fun, that type of stuff. And don't let the kids sleep with a bottle of milk, juice, or whatever it is. It's just not good. And there are ways.
Don't forget the vitamins with fluoride too.
Right.
So very critical in so many areas. But once again, check the fluoride status of the fluoride in your water. Do you have well water that may have fluoride in there? Because too much fluoride is almost as bad as not enough fluoride.
Got it. So basically, and the only way to really find that out, because I don't think you can expect us people who have kids out there to kind of get all that, is go to the dentist, ask, do it, and you probably can then tell the mom, take a little bottle, bring it to the city, bring it wherever. Somebody will do what needs to be done, especially if from a dental viewpoint it looks like things might not be quite okay. That's usually that's the first time you look into it. As long as everything goes fine, there's no reason to test everything. Just like with being ill, right? There's no reason to test certain things as long as you're fine. You start looking around. All right, thank you very much.